So let's talk about something every parent needs to know: a child's swollen eye. When is it just a minor thing, and when is it a sign of a real emergency? That's what we're breaking down today. And we're going to start with a real story, a situation that could happen to absolutely anyone. Picture this: a 12-year-old girl. She shows up at the emergency room. She's got a pretty nasty swollen eye, a cough, and a headache.
So, the doctors take a look, and their initial diagnosis is periorbital cellulitis. Now, she seemed pretty well otherwise, but her blood work told a different story. It was showing clear signs of infection. So, they admitted her to the ward and got her started on IV antibiotics right away.
So, what exactly is periorbital cellulitis? Well, it's the most common diagnosis for a swollen eye in kids. You can think of it as an infection of the eyelid and the skin right around the eye. And the key thing is, it's happening in front of this crucial little barrier inside called the orbital septum.
Now, this kind of infection doesn't just appear out of nowhere. It usually follows some other problem. In fact, more than 80% of these cases are actually linked to a sinus infection. But it could also be something as simple as a little bump to the eye area or even just an insect bite.
But here's the deal, and this is so important. Not all eye infections are created equal. The difference between them is absolutely crucial, and understanding that difference can literally be sight-saving and in some cases even life-saving.
Okay, this chart just lays it all out perfectly. On one side, you've got periorbital cellulitis. That's a skin infection. But on the other side, you've got orbital cellulitis, and that is an infection inside the eye socket itself. This one difference in location changes everything. It turns a pretty common problem into a true medical emergency.
So, let's talk about that barrier I mentioned, the orbital septum. Think of it like a gate. If the infection is in front of the gate, we call it preseptal or periorbital. That's manageable. But if that infection gets behind the gate, it becomes postseptal or orbital, and that is when things get really dangerous.
All right, let's get back to our 12-year-old patient in the hospital. It's the next morning. She's been getting those IV antibiotics, but her condition is about to change.
So despite the treatment, the swelling hadn't improved one bit. And even worse, she'd developed new, really alarming symptoms. She now had pain when moving her eye, and something called ophthalmoplegia, which is basically a weakness or paralysis of the eye muscles. This was a massive signal that the infection was much more serious than they first thought.
So this gets to the heart of it, right? How do you tell the difference, especially when you're dealing with a kid who can't always tell you exactly what's wrong? You have to know what to look for, the signs that tell you the infection has crossed that critical line from the eyelid into the eye socket itself.
And these right here are the warning signs that demand immediate emergency attention. If you see any of these, I'm talking painful eye movements, a bulging eye, which doctors call proptosis, or any complaints at all about their vision changing, it is time to act fast.
As soon as those red flags went up, it was a race against time. Her doctors immediately ordered an urgent CT scan to see exactly what was happening behind her eye.
And this is the diagnosis that doctors fear: orbital cellulitis. The infection is now deep within the eye socket, surrounding all the delicate muscles and fat that let the eye do its job. This isn't just an infection anymore. This is a full-blown surgical emergency.
And the danger here is twofold. First, all that pressure and inflammation can cause permanent damage to the optic nerve, which can lead to vision loss. And second, the infection is dangerously close to the brain. It can spread.
The stakes are just incredibly high. We're talking about the infection leading to abscesses, meningitis, or even a life-threatening blood clot in the brain called cavernous sinus thrombosis. These are potentially devastating, lifelong consequences. Her CT scan confirmed their worst fears. You can see it right here on the scans: signs of infection deep in the orbit, an abscess forming, and her sinuses are just completely filled up. This was the smoking gun that confirmed it was orbital cellulitis.
So what happened to the girl? And what is the vital takeaway for all of us from her story?
Well, thankfully, after being transferred to a specialized hospital, she underwent emergency surgery to drain the abscesses in her eye socket and nose. And that, combined with some powerful antibiotics, did the trick. Just 6 days after her surgery, she was able to go home. It just goes to show you how absolutely critical that rapid action really was.
So this is the protocol every parent needs to remember. First, any kind of periorbital swelling needs a doctor's visit, period. Second, even if they start treatment, you watch them like a hawk for those red flags we just talked about. And third, if a single one of those flags appears, don't wait, go back to the emergency department immediately.
You know, the final takeaway is this. A swollen eye can be so much more than it seems. The difference between a simple skin infection and a sight-threatening emergency comes down to a thin wall of tissue and a few key symptoms. The crucial thing to remember is to trust your instincts, know these red flags, and never, ever hesitate to seek emergency care.